Hi, my name is Sadiya Khan, and I'm a preventive cardiologist and cardiovascular epidemiologist at Northwestern University Feinberg School of Medicine. And I was honored to serve as the chair of this new joint AHA-ACC scientific statement that is accompanying the new 2026 Cardiovascular-Kidney-Metabolic Syndrome Guideline. We are at a very exciting point in medicine. We now have the scientific background, the therapies, and the risk prediction tools to more effectively prevent cardiovascular disease, particularly in people living with or at risk for cardiovascular kidney metabolic syndrome. And that was the premise of the new guideline document. But there's a lot of complexity that comes with the use of risk assessment in this guideline document and how it can be applied to patient-centered discussions and decision-making. And that's what led to this joint society statement. Our goal here was to describe how the PREVENT equations were used in the new CKM guideline, review the evidence base that led to this concept of risk and benefit guiding these decisions, and consider practical guidance in how we can implement the new recommendations to improve health for all. There are three key things that I want to highlight in this new scientific statement. First, the PREVENT equations are at the center of risk assessment discussions and decisions. Specifically, there are three key thresholds that are outlined in the CKM guideline that are important to remember. For CKM Stage 3, the 10-year PREVENT CVD risk cutoff of 20%, so higher than or equal to 20% at 10 years, is equivalent to CKM Stage 3. Next, the 10-year PREVENT heart failure risk score of greater than or equal to 5% is identified as a group where identifying subclinical heart failure with echocardiography, biomarkers, and additional coordinated care can improve prevention. And last, the importance of using the 10-year PREVENT CVD greater than or equal to 7.5% in people with diabetes to decide on treatment. So those three numbers are important to remember, as well as think about which specific PREVENT equations are being used. We mentioned PREVENT CVD and PREVENT heart failure, and of course, the recent dyslipidemia guidelines incorporate the PREVENT ASCVD equations. Second, a key part of this statement is really defining the concept of benefit. We want to use risk equations like PREVENT to identify those people that are most likely to benefit from drug therapy, as opposed to exposing everybody to drugs that may not really help them. We know that some people are at very low risk and unlikely to develop a disease, and therefore drug therapy is not very high yield. So this is a key concept that the PREVENT equations help to support. Third, and importantly, the scientific statement reviews key strategies in risk communication and implementation science that are going to be critical as we move forward. Work being led by the American Heart Association, like the CKM Implementation Initiative, is going to be central in these efforts. We hope the figures and tables in the statement are helpful to complement clinicians as they engage with the new guideline, and we're excited to support a true paradigm shift in the clinical care of patients with or at risk for CKM syndrome.